Hi, welcome everyone, and thank you for attending our session today on future-proofing shared care delivery. I'm Spencer Noble, Head of Business Development from Cegedim Healthcare Solutions, and I'm joined today by one of our NHS partners, Tracy Wyness, from NHS Tayside in Scotland. So in this session today, hopefully you'll see how we collaborated with one of our partners to successfully implement and scale our shared care solution across multiple settings and services. We'll explore how a solution designed to put information into the hands of the right clinician at the right time led to improved patient outcomes, whilst also relieving pressures on GP practices. By utilising intelligent system design and efficient integration across existing GP clinical systems with efficiency at the heart of it. We will demonstrate how this facilitates supporting patients in diverse health and care settings at scale whilst being able to maintain primary care clinical records in real time. We'll then briefly touch on how that data gathered provides insights into better understanding of health trends, supporting clinicians and ensuring services are configured to match patient need through actionable data, leading to changes in service design and improvement in patient outcomes for the population. There'll be opportunity for questions at the end of the session, so there's a couple of mics that will be roving around, so if you can keep hold of your questions until then, and then we'll give some time to that at the end. So, Tracy, thanks for coming down. Long journey from Scotland.
You're welcome.
Do you just want to introduce yourself to the audience and tell them a little bit more about NHS Tayside?
Sure. I'm Tracy Wyness, and I work as the Primary and Secondary Care Service Delivery Manager in NHS Tayside within the Digital Directorate. And we have responsibility for all primary care contractors as well as the secondary care, supporting the secondary care teams across hospitals. So my background, I have 35 years now in health, and I started as a computer girl. It was called way back in 1986 when the first computer was brought into general practice, which was a single standalone computer, and it's piqued my interest since those early days, and I've followed general practice really through that journey. More recently, we are a board of 63 practices when we actually started this journey. We're now down to 61 practices. We have 63 practices, and it's predominantly Vision, the Cegedim solution that we use, with the lion's share of the practices using that. We have 3 different health and social care partnerships in Tayside, all working very differently, but there's really strong links across all 3. So that was sort of the starting point for us when we came across this journey to link in with Cegedim for solutionising for us.
Okay, thank you for that. So talking about the shared care service then, so what was the main driver for that change and to a shift in delivering services across the health board rather than at practice level?
So the main driver for us was the new GMS contract in 2018. So that saw the introduction to ease pressure within general practice, the introduction of new services that would share the workload and would take on some of the work previously undertaken by GPs, and the GPs would become expert medical generalists and focus on patients and seeing patients with chronic illnesses and things. So there was a few services that were set up. Community, there was care and treatment service, first contact physiotherapy, vaccination transformation, the vaccination programme. There was urgent care, community link workers or social prescribers, and the community mental health team, along with pharmacotherapy. So all of these services were started up, and we began a large programme of work called the Primary Care Improvement Programme, and that brought in all of these services over a 2-year period, and we had to provision a system that they could use. So that was the driver. Now, we had some inkling because we were involved in a project previously in a small rural village in Tayside called Letham that doesn't have a GP practice, but it does have a requirement for nurse-led services. So there was services working out of a small hub in Letham. Now the challenge there was that that village is actually served by 7 different GP practices in the surrounding area. So there was no records, electronic records kept there, and the challenge to get that up and running left us sort of scratching our heads. We have really strong relationship with Vision at the time, Cegedim, and we went to them and approached them for a solution to see if there's something that we could do to access the GP record. So back in 2016, it was presented to us that we could potentially use this shared solution, which would allow the nurse in Latham to access the record for any practice, for the patient from any of these practices, which we thought, gosh, that's fantastic and too good to be true, let's try it. So we had some inkling that this approach may fit the new GMS contract services that were being brought in. So that was our sort of driver and the reason why we went with the shared solution.
Okay, thanks for that bit of background. So obviously, it's a big challenge that you've got to look at. So practically, what was your first step in that process?
Well, the first step was really to pull together the project team. We brought together the project team, and we also had to get buy-in because we need funding for it, and we needed this to be adopted across the whole area. We also needed buy-in from general practice as well, because this is fundamentally, these services would then be using the GP record. So we needed buy-in from the practices. So we brought all of these groups together, so general practice, the service leads, supplier and colleagues within the board, finance, etc., and brought them all forward to look at what we could do to start this up. And it was decided that we would start small. So although we had experience with Latham, we would try a test of change with the new services and to look at how that would go. Alongside that, we had a parallel piece of work running, which was to gather the high-level requirements for each of these services. Now, bearing in mind, we were running before we were walking, and a lot of these services didn't exist yet. So we were developing their requirements as these services were coming on board. So we agreed a small test of change to get started with that.
Okay, so as part of that test of change process you've just touched upon, did you set any criteria as to what you wanted from a digital solution to enable you to be able to deliver what your ultimate outcome was?
Lots. There was lots, and I've actually had to take notes for this so I didn't forget any. So it was really important that the clinical teams were able to support multiple practices from a single system, from any base, allowing for fuller utilisation of treatment areas. A lot of practices didn't have accommodation to take on these new services, so perhaps the services would be within a cluster, and there would be a hub model. So patients from practice A could go to the hub, which was hosted in practice B, etc. So we had to be able to operate across multiple sites. We needed to ensure that the clinician that was seeing the patient had access to the patient's primary care record. That was critical. That was the thing that they said they needed the most. It had to be easy to use. We couldn't add another system in without it being easy to use, and I have to say that we did find that was the case. I mentioned before we had to do the gathering of the requirements for the services, so that had to, because we had to, not alone, there were still some services that weren't in the test of change, so we still had to collect the requirements just to make sure this solution was the fit for all 7 services. And then we had to make sure all activity was captured in an audit trail. This was to give reassurance to both the clinicians seeing the patients and the host practices as well.
Okay, thank you. So you talked about your initial services, and you're saying that you selected 4. Was that mainly because of familiarity with those services from a user perspective, and obviously therefore theoretically easier to implement, or and how have those services evolved over the last 4 or 5 years?
It wasn't actually. It was those 4 services were ready. So right. The 4 services were selected because either they put their hand up as saying, we have an established service already that we could come on board, or that they were actually, they'd decided that they would move quickly to get the service up and running. So the 4 services out of the list that I provided earlier that we started in Tayside were care and treatment service, first contact physiotherapy, the vaccination programme, because we'd already started to move things from practice to the vaccination transformation team, and urgent care, which was a new service, but actually we thought that would be a really good test, especially with the ability for Vision Anywhere, which you could use online or offline. So we thought the urgent care solution, it would give us a really robust test of that functionality within the product.
Okay, thank you. So obviously there's a big change involved here for the users, and change management and managing that change for them must have been, quite key to the implementation, and a big challenge as well. So how did you work with them to ensure that you got that smooth implementation of the service redesign, and what challenges did you face during that process?
So we collected the requirements from the services along with their target operating model to understand where their base would be and what would fit best. So as I mentioned previously, we had this sort of hub model. So that was one of the things that we set up. We needed to have access to the clinical staff. Now, all of these staff are practicing clinicians, so that was quite challenging to get time. So we worked around, and actually the support that we got from Cegedim, they worked around us as well. So we were all on board, so it was quite a lot of lunchtime training sessions, and I'm sure people are familiar with that. Certainly within general practice, things are done either at night or at lunchtime. But that was a challenge, but we were really fortunate because the first team that went with the solution were delighted. So it actually smoothed the way for the other services. So I wouldn't like to say there's no challenges, but actually, maybe I'm looking back with a rosy glow. This was a couple of years ago now, but actually it seemed to go really well.
Okay, great. So as part of the service then, there's obviously an evaluation process at the end of it, or part way through it, to see how things are going. Did you engage with patients at all, and what was their feedback during this process?
We did, and it wasn't huge, to be honest. We actually just had small questionnaires that were 3 questions and a comments box. And we asked the clinicians to give these to patients as part of the patient contact, and they had a box at reception, and they just popped the feedback in. And it was not so much about the system, obviously the patient's not using the system, but it was about their expectations and things. And again, I've taken notes of these, but we wanted to capture whether or not, because there was some conversation, and it's changed a lot since then, but there was conversation that the expectation of the patient would expect any clinician who was seeing them to have access to their record. Now, I don't know, I remember going into a hospital with my dad many years ago and assuming that they would have access. Now, I worked in the NHS, but assuming they would have access to his medication, but yet they still had to trawl through this big, huge bag of medication, and they didn't actually have, back then, access to the GP record. Yeah. It's changed now in Tayside, we're way ahead. But anyway, we wanted to capture that to find out what patients thought, and 100% of patients said that it was their expectation that the healthcare professional involved in their care would have access to their patient health record. So that was our first question. Then we asked, do you feel the professional you saw today had access to enough information about you to support the consultation? And again, all said yes to that. So that was 100% as well. And then, where offered, was the ability to choose an alternative location other than your own GP practice helpful in gaining appointments? And again, we got 100% return on that one. We had a few comments as well that said that the service was great, prompt attention, and it was happy that they were able to go to any medical centre. So there was a few comments back. I just cherry-picked some out there. But the patients were, happy with the service that they got. I didn't ask them about the solution, but they were absolutely happy with the service that they got.
Yeah, it's great that you got that patient buy-in, because that's half the battle, as well as getting the user buy-in as well. So we talked about that evaluation process then. So from the service evaluation, what was the overall conclusion from that, and the outcomes from that? Did it meet what you intended it to do at the start?
We used a return on investment sort of approach. So we set out objectives right at the start, and we looked at sort of from level 1 all the way up. And I'll pick out just some of them, because obviously what we wanted the users to be on board, we wanted the practices to be on board, and the patients and all of this. So we started at that, looking at engagement and all the way up to learning and through. But I'll just touch on the level 4 objectives that we captured, and I'm happy to share if anyone's interested. I've got lots of information on it. But what we'd said, and we were probably a bit optimistic when I say, so we didn't fully meet some of these, but it was a success nevertheless. But we looked at, in 5 months, the test of change was to run for 6 months. It was extended slightly due to the delay for some services coming on board, but we said at 5 months we wanted 50% reduction in the requirement for staff to travel to access or input into the patient record. Now, we actually achieved 40%, but we should have been more clever with that objective, because there was only one service that did travel. So the numbers weren't quite the same, but it was 40% reduction for them having to go back to a practice and enter information into the patient record, because they just had a laptop and popped it into Vision Anywhere, and then the GP had access to that straight away. We also set up, by 5 months, 80% of patients participated in the survey confirmed that the professional they saw had enough information about them to support the consultation. And I already mentioned we got 100% hit on that one. We had 5 months, 90% of patient information will be available in the GP record within 30 minutes. Now, we actually excelled that, and I think it was never more than a couple of minutes. But 30 minutes of the patient contact when recorded online. So that again was a really good measure for us. And then another one at 5 months, we expected 50% of staff reporting a reduction in duplicate recording processes. And again, we achieved that as well. The practices were using, so they were having to record it in their own nursing system, record it on paper, and record it back in the practice. So we had lots of recording going on, and they didn't always fully match. So this way we know that exactly what went in at the point of care was what was in the patient record, which was really good. And then by 5 months, 50% of patients in the test of change cohort being seen had been appointed by the GP practice. And this was just important for us to see the shift of the balance of care moving, so that the work would actually transfer. So it's not additional work, it was actually work that the GP previously would have done that was now being undertaken by these services.
Okay, thank you. Obviously, very successful program that you've put in place. And I guess you feel that you've achieved your aims of being able to scale and deliver services across different care settings based on the results that you just related to. So do you see that the program's going to continue? Has it been fully embedded? And do you think there'll be more service models added in the future?
Yep, we already have actually. So we've added an additional service. We added COVID. I don't want to bring everybody down by mentioning that word, but we did add to support the COVID and the for business continuity for practices. So if a practice was completely shut down due to COVID, then another practice could pick up their records and actually support them. So we had that as our backup plan throughout COVID. So that was one of the services. We're just working now on the drug misuse service and implementing that in Tayside, and that's just going to be in Dundee. So that's a service that's just Dundee only at the moment. So it's well established. We've had over 400,000 contacts through our shared solution, and it's fully embedded. I don't think we would be able to remove it, even if we tried. There would be, there's no way. It's firmly embedded, and with us having all of our practices almost on the Vision GP system, it works really, really well for us. So we do have a format now that if a new service comes on or wants to come on board, there's sort of a forum that we get them to complete through our service desk, and then we'll take that to our governance group who will look at it to see if that's the right fit, and then we'll start the ball rolling with the new service.
Okay, brilliant. Thanks for that. So then you talked about having it like almost like a shared care record and vision systems across the health board. Having that one source of truth and all the data being in one place, in effect, has it been an advantage? And how do you plan that you're going to utilise that data to improve that service and patient outcomes moving forwards?
Well, I think we're in a good position, to be honest, you know, with bringing on new services, and I think we do have a piece of work still to do. So it's not, when I'd say it sounds like everything's fantastic and it's all been great. There are bits that we still want to do. So there's additional bits that we've not quite got to. So we've got a bit of around reporting that we want to work on. So that's part of the future for us, is looking at outcomes manager. And we're working with Cegedim to get the right fit of, you know, and our requirements, what we need at practice level, at a health and social care partnership level, and at a board level. So we've still got quite a bit of work to do there. There's a lot of new features coming with Vision Anywhere, and we're going to be adopting all of these. So there's quite a lot of work still to do. But I think what we've done is we've achieved our core goals were really to have that patient record, the single source of truth, and to have that updated, and we've well and truly achieved it.
Okay, great, thanks. So if there's one piece of advice you could give to the audience about where to start and what to do, what would that be?
It's probably around relationships, and it's having strong relationships with the business, and, you know, with our services, with our clinicians, with our practices, and with the supplier as well, to be honest. We had a really strong relationship with the supplier. We meet regularly, and, you know, it was them that brought the solution to us when we were scratching our heads wondering what to do. So we have been fortunate to have that embedded, but I think to build on that, to have a really good project team, and to have buy-in. So you need to have buy-in with the people with holding finance, and also buy-in from the users to see that they can see that what the benefits would be to having access to the patient record pretty much at any time.
Thank you for that. Thanks a lot for that, Tracy, and thanks for those insights. I hope today you've found it very interesting and insightful. I hope the brief discussion has shown what can be achieved through working in partnership with NHS and suppliers jointly, hand in hand, and meeting that challenge of delivering shared care services across multiple settings with different healthcare professionals. And through that careful planning and engagement with all stakeholders, you build those relationships, and it means that you then deliver a successful implementation, and working with your supplier to evolve the service and also the IT as you go along, working in hand to meet the need is what is really required to move things forward and make things successful. So thanks a lot, Tracy, for coming down from Scotland. Appreciate the journey it's been for you. Thanks for sharing your experience and insights. I hope everybody has found it useful. Thank you, audience, as well, for attending. If anybody's got any questions, we are on stand E95, which is just outside. Tracy will be with us for a little bit for this morning until she has to get a train. So please come along and see us. And thanks for your time.